How to treat scoliosis. Scoliosis is the development of an unnatural sideway spinal curve that also rotates into the concavity. The nature of scoliosis is progressive, meaning it's virtually guaranteed to worsen over time. We just don't know to what extent it's going to worsen and how fast it's going to worsen. We definitely know diagnosing scoliosis can lead to early treatment, even though there's never completely 100% treatment guarantees. But as curves are treated earlier, when they're detected earlier, there's typically fewer limits to what could be achieved and normally better results. So diagnosing scoliosis early means that we can able to treat scoliosis early. So we always recommend early diagnosis and early treatment typically leads to a much better result because we're treating it before the curve progresses into a higher level, and higher curves and bigger curves and older patients are always more difficult to treat. So treating a scoliosis when it's diagnosed or as soon as it's diagnosed typically gives us the highest chance of success. So one thing to understand is that if you want to treat your scoliosis, treating it sooner to diagnosis as opposed to later when it worsens, typically it will lead to a much better outcome. Like I said, milder scoliosis is much more simpler to treat. Now, scoliosis has different severity levels. They range from mild to moderate to severe to very severe. The condition's severity is determined by a measurement called a Cobb angle. And the Cobb angle is an angle that's measured on a scoliosis x-ray. The higher the Cobb angle, the further the alignment out of the spine and the larger or the more severe the scoliosis is. These curvatures can range from mild to moderate to severe to very severe. So therefore, if we find curves early and treat them in a milder form, we're going to have much better results. Now, is scoliosis curable? I mean, can we correct and cure scoliosis completely? Scoliosis is an uncurable condition because most cases we don't know what's causing it. It's an idiopathic case, meaning unknown cause. However, even though it's uncurable, we do know scoliosis is progressive. So when we look at treating or reducing or correcting scoliosis, what we're meaning is that we want to stop progression and reduce the size of curve. By correcting or reducing the size of curve, we can alter the way the curve is progressing, therefore alter the natural course if it was left untreated. There's two main specific scoliosis treatment approaches, something that I like to call traditional approaches versus something that I like to call conservative approaches. Now, traditional treatment tends to funnel patients towards spinal fusion, while conservative treatments offer less invasive non-surgical approaches, and the goal is curve reduction and spinal function. Traditional treatment options typically don't have any type of treatment strategy for mild scoliosis. So in the traditional approach, if you diagnose your scoliosis earlier, which is what we normally recommend, and you're diagnosed with a curve that's mild, meaning less than 25 degrees, more commonly traditional treatment would recommend nothing. They'll just recommend watch and wait. Now, during this phase of watching and waiting, you're losing a great opportunity and making a big impact on a small curve. And the argument from traditional treatment options is they say, well, we don't know how much bigger this curve is going to become. We don't know if it's ever going to become surgical, so that's not worth treating. Our argument is that if you treat a small curve, you'll never have a severe curve, so treating a small curve will give us a greater chance of never developing a severe. Then their response would be, well, you could be unnecessarily treating this curve because it may not worsen any. Then, of course, we always like to say that there's no harm in making a small curve smaller. Like taking a 20-degree curve and making it 10 degrees, there's no really harm in that. But in letting a 20-degree curve become 45 degrees, there's significant harm to that. So we always like to treat small curves because smaller curves will always give us better results. Unfortunately, if the curve were to progress beyond mild into the moderate form, meaning which greater than 25 degrees but less than 40, in this phase, nothing is also recommended for the majority of cases. The only exception to this is if the patient is growing. They're going through their pubescent growth spurt and they're rapidly growing. In this phase, they may recommend a traditional brace. Traditional bracing, like Boston braces or Providence braces, are just trying to slow down the curve progression during this growth phase so the curve doesn't progress into the severe level. Unfortunately, these braces are not designed to reduce the curve, not designed to make it smaller. not designed to actually improve the shape, just trying to slow it down. That's why they only use it during growth phase. These braces have very, very limited effectiveness, and that's the reason why our surgical rates of scoliosis in the United States is so high. So therefore, we're not against bracing, but we don't like these traditional style braces because they're limited in how effective they become. Once curves break 45 degrees and the patient is still growing and developing, now they start considering spinal fusion and surgery to try to reduce the size of scoliosis and stop progression. But they do this at the cost of overall spinal health and function. Spinal fusion is a non-functional approach. They're sacrificing movement and function of the spine for alignment by fusing the spine together using rods and screws and bone grafts. Our goal is to avoid that. Now, spinal fusion, depending on what country you live in or what doctor you see, can happen or be recommended at different sizes. Typically, the most aggressive number would be about 40 degrees, but some doctors will wait to 45 or 50 degrees. And the reason why they have to wait till curves become this severe before they would consider spinal fusion is because the effect the spinal fusion has on the spine. If spinal fusion had no negative effects on the spine, they would do it at 20. But the reason why they have to wait for it to become 40 or 50 degrees is because the negative effects and the lifelong impact it can have on the person's health and well-being. Now, conservative treatment options are definitely very different options. Our goal is to actively try to reduce the curve during the entire phase of care. And the reason why we want to actively try to reduce the curve, because we believe the smaller the curve you have, the better off you are. Whether, having a 20-degree curve is better off than having a 30, and 30 better than a 40. So why let a curve ever worsen? We don't see any benefit in letting your curve become bigger. So we want to treat curves as soon as we diagnose them. And we want to reduce them as quickly and as fast as we can, so therefore the patient can have a better outcome as a result of their treatment options. The first thing we look at is something that we call integration. We integrate multiple treatment options to deliver a corrective result. Meaning, when we talk to most orthopedic surgeons or most traditional doctors, when they think of conservative treatment for scoliosis, they think of one of two things: Boston bracing, like I mentioned, and they don't consider anything else. Because if you think of therapy or rehab or exercise or chiropractic care, what they're typically thinking of is injury treatment. And injury treatment is done very little over a very long time to help assist somebody in the healing phase. So it's very low dose. It's normally strength-based, range of motion-based to try to help somebody feel better as a result of injury. Now, normally, that type of treatment model is very effective for injuries, but that type of treatment model is not very effective for scoliosis, and because of this, it's normally not recommended. However, all these same things can be altered and used in such a way to deliver a very effective result in treating a scoliosis. First thing let's talk about is chiropractic care. We know chiropractic care focuses on the spine, focuses on the alignment of the spine, but the main difference is when we look at scoliosis-specific chiropractic care is that the chiropractic care is structural, meaning the adjustments and the care that's given is trying to help realign the spine into a better structure. When we look at physical therapy, traditional physical therapy is normally done to help increase strength and increase the strength of the body. But most patients with scoliosis don't have a strength issue, they have an alignment issue. So the therapy that we use is structural-based therapy to help improve the structure of the spine. By improving the structure, we can improve posture, we can improve muscle imbalance, we can improve certain areas for the way the brain and the body responds to gravity and brain-body communication. So we're using physical therapy in a structural way, not just range of motion or strength. When we look at bracing, we don't use traditional bracing just trying to slow down curve progression. We use something called corrective bracing that's going to help push in the spine and body to help improve the shape of the torso and help reduce the scoliosis. This is all our in-office therapy and treatment. And then last thing is we take whatever we can take out of that, and we also prescribe it for home use so patients continue to do all the home therapy and home rehab to help stabilize this scoliosis and reduce it. And then we combine all of these treatments in a way that we're evaluating and reducing to get the curve as low as possible. The goal here is to have the straightest possible spine with as much function as possible. Spinal fusion is straighter spine with lack of function or less function. So they have very different outcomes and very different goals. So our goal here at Scoliosis Reduction Center is to treat scoliosis patients using this conservative chiropractic center approach at working at trying to prevent progression, reducing spinal curvatures, and retaining function using all the customized therapies and rehabilitations that we mentioned. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.